Welcome to your online training module, Introduction to Medical Entomology. In this unit, we will explore the One Health concept, an approach that recognizes the interconnectedness of human, animal, and environmental health. But before we dive into the details of this concept, let's take a closer look at the initiatives currently being implemented in Vectorlandia as they respond to ongoing health challenges.
Following the task force's assessments, the Ministry of Health reviewed its vector-borne disease strategies and found key gaps. To address these, it strengthened the task force and adopted a multi-sectoral approach, adding animal and environmental health experts to improve surveillance, prevention, and response efforts.
The One Health concept, as defined by the U.S. Centers for Disease Control and Prevention as a collaborative, multi-sectoral, transdisciplinary approach, working at a local, regional, national, and global levels, with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. In the past, policies to address health concerns were often linear and compartmentalized, where environmental health issues were managed by environmental officers and policymakers. Animal health concerns were handled by veterinarians and agricultural sectors, and human health was addressed separately through medical and public health systems. While the links between environmental, animal, and human health were recognized, there was little effort to formalize collaboration between these three sectors. As a result, policies often failed to account for the interconnectedness of health threats, leaving critical gaps in prevention and response strategies. When addressing vector-borne disease surveillance, it is important to recognize the multiple interconnected components that influence outbreak risk. These include vector proliferation occurs where conditions such as standing water or inadequate sanitation create breeding sites. The introduction of pathogens through travel, trade, or animal movement. Environmental health factors such as deforestation, land use change, and climate conditions. Focusing on the human exposure based on individuals' infrastructure, housing quality, and protective behaviors. And lastly, on animal health. How the role of sick or untreated animals may act as reservoirs for pathogens. Poor infrastructure, unmanaged animal health, and environmental degradation, such as deforestation, directly increase human vulnerability to vector-borne diseases. This highlights why surveillance must take a holistic, One Health perspective, rather than focusing on a single factor in isolation. However, the One Health concept is not limited to vector-borne diseases. It is a flexible framework that can be applied to a wide range of global health concerns and is actively supported by organizations such as the United Nations and the World Health Organization, WHO. The strength of One Health lies in its multi-sectoral and evolving nature. It requires continuous collaboration across disciplines to anticipate, prevent, and respond to emerging threats. Currently, One Health committees around the world address major health challenges such as antimicrobial resistance, zoonotic disease outbreaks such as avian influenza, rabies, vector-borne diseases such as malaria, dengue, Rocky Mountain spotted fever, food safety and foodborne diseases, and environmental health concerns related to pollution, deforestation, and climate change. By integrating expertise from human, animal, and environmental health sectors, the One Health approach provides a comprehensive strategy to protect populations and strengthen resilience against outbreaks. What One Health seeks to address is the improvement of surveillance programs in an efficient and sustainable manner, maximizing available resources, minimizing waste, and strengthening policy development. When effectively implemented, the One Health approach helps to close coordination gaps between policymakers and sectors, pool limited resources for greater collective impact, develop inclusive policies that reflect human, animal, and environmental health needs, establish early warning systems across departments to detect emerging threats faster, deliver unified awareness campaigns that communicate with the public using a clear and consistent message. By aligning priorities and resources, One Health not only improves outbreak preparedness but also ensures that health concerns are addressed in a cohesive and proactive manner, rather than in isolated efforts. In the current structures, when collaboration does not occur, valuable time, resources, and effort are wasted in addressing issues that are often shared across sectors. As we have seen in this module, the connections between animal health, environmental health, and human health are deeply interwoven. Failure to recognize and act on these linkages can lead to gaps in prevention, slower responses to outbreaks, and missed opportunities to protect communities. As we conclude this module, let's review what we have covered. We explored the history of vector-borne diseases in the region and examined emerging threats that continue to challenge public health. We discussed how environmental and ecological changes influence disease dynamics and how animal health is closely linked to human health. Finally, we looked at how collaborative, cross-sector efforts provide a holistic approach to addressing these challenges, emphasizing the importance of the One Health framework in building stronger, more resilient communities. And now let's meet with Dr. Joe Myers, a certified One Health leader, as he shares his experience with the One Health initiative.
My name is Joe Myers. I'm a veterinarian with the Belize Agricultural Health Authority. My post is the Registrar of Veterinary Drugs, Veterinary Pesticides, and Animal Feed. And I'm also a certified One Health leader. I've been in this post for the past 23 years. In my experience, the sector with the largest gap would be the environmental health or environmental science. And that is probably attributed to the fact that it's a relatively new science compared to animal health or public health. The way this could be addressed is quite simply. It has to do with the sharing of information, the sharing of data, and even that it has to do research, have everyone involved. So there's a certain flow to the information being shared. Even though One Health constitutes human health, animal health, and environmental health, for One Health, the main outcome, the goal that we try to achieve is improve public health outcomes. And we need to look not only at lives, but also at livelihood, because while we may survive, there are other factors out there, such as having food security, shelter, etc., that are factors that determine our survivability. As mentioned earlier, there's a lot of information out there. There's a lot of stuff being done, haphazardly research, etc. And there's no set format to share the information. And the way this could be improved is quite simple. Having an integrated surveillance approach. Having compromise, respecting each other's position, but at the same time, do away with the egocentric approach. As a proponent of One Health, definitely. As you may know, all health is based on prevention. And one of the problems has been that we do not nip the problem at the bud, in that as it relates to vector-borne diseases, a lot of the measures taken are basically to cure versus to prevent. We need to integrate all three aspects, because there's a lot of other factors that affect the proliferation of the vectors. For example, climate change, movement of people. There's a whole lot of factors apart from the health, which both animal and public health. For example, it would be important to be able to test these vectors and see whether they have the pathogens or not, and the susceptible animals, be it wildlife or domestic animals, and then we could eventually avoid it being spread to human and help us with what we would call programming or even forecasting. We need to also reach out to the grassroots people who would then take ownership so that we have sustainability. That has been one of the main challenges. Projects start, research start, and then they end abruptly. There's no follow-up or follow-through. The key word here would be sustainability.